it never amazes me how many times that we do just this one simple exercise that people that have never really done this before. So what I want you to do is to push down against the spotter's hand, and they're going to hold about like a medium resistance for maybe 3 seconds, 5 seconds the most. And then they're going to let go. And what you want to see is you're going to continue to push, push, push. They're going to let go. And you want to continue then to drive, pushing backwards until the heel all the way comes down and touches the floor. You don't want it to stop. You don't want it to hang in the air. You want to bring it all the way down, right down to touch the floor. Okay? Pushing on the back wall of the socket. That's what we're going to talk about a lot. Pushing on the back wall to bring the prosthesis down to the ground with control. Don't let it fall down to the ground. We want you to bring the leg down to the ground. Okay? So that's one of the main things we're going to talk about. The next thing we do is an exercise called leg swings. Actually learning to swing the prosthesis underneath you in a very controlled manner. Trying to get a full range of motion out of the knee and trying to get a full range of motion out of your hip. Now, some people we did this with last time, some we couldn't because the knee actually wasn't able to bend in swing phase. We'll talk about that in a few minutes. But starting position when we do this, again, your inside parallel bars, you hold the prosthesis up. First thing you want the person to do is, again, push to the back wall of the socket, bring that hip all the way through, extend. Simply push on the front to bring the leg all the way through straight. Now, again, because so many above-knee amputees, we're so much stronger in the hip flexor muscles that when we do this exercise for the first time, and I don't care if it's 3 months from amputation or 30 years, when people do this for the first time, what we mostly do is something like this, and we'll just kick the leg out. We'll just kick it on out. And people walk this way all the time. What we really want you to do is to first push to the back, and then to the front, so you have to fire those extensor muscles. You have to learn to bring that hip through to as much of a full range of motion as you can learn to control. Not what you think you can, because again, most people when they do this, they start out, Mr. Jones, 75 years old, he's inside the parallel bars, he starts to do this exercise, it's a very small range of motion, a very little swing. That's the beginning. But a lot of people think, not only is that the beginning, that's also the best it's going to get, which is not the case.
So again, Greg, you remember, right?
Yeah. Well,
What did you remember?
the first one, you had a video of one of your patients, and he was kicking up head high in front and butt high, I guess, all the way in the back.
Right.
And they have me doing that as a regular exercise here. And it's a real workout. It really, works your muscles, both the front and back, and also your stomach muscles too.
More.
Yeah. So.
So you can do discount double check.
Yeah.
It's actually a great point that you bring up, because what we try to, by coming to the program the very first time and seeing everything, you learn where those muscles are. But for most above-knee amputees, they don't realize that those muscles are still there. So that's why you pull to the back, push to the front, in an effort to make sure that we are exercising those muscles, especially the extensor muscles in the back part of the leg, because that's where you get all your stability from.
So,
What do you do with the hip flexion contraction?
what do you do with it? They just got to deal with it. You try to stretch it out in therapy, but you just have to go till it's going to be limited by the contraction. However, you can still work on the range of motion that's still there and try to control the range of motion that's still there. So when the person does this, like we said, always the hip flexors are so much stronger, they kick the prosthesis out. People walk this way all the time. It never fails. Sometimes you see someone that walks where they come through and they kick the prosthesis out and they'll just drop the leg down to the ground. When they come on through, that leg goes into full extension and they'll be up in the air and have like a foot of clearance before it drops down to the ground. Right? You check those extensors and either they're not using those muscles or they've just never learned to use them before. So very simply what we do as a spotter is just you're going to have your hands on that socket, one in the front, one in the back, and just move the leg in the direction you want it to go. So for this simple exercise, pushing backwards and forwards, helping more of a push to the back, because again, that's where the weakness is, in those back muscles. Teaching the person when you stop pushing to the front, which you probably have to think about it. When do I stop pushing to that front? When you start pushing to the back. to keep that cadence going for that range of motion. We do the heel strike, and it always looks something like this. Because we always lean back. We go to the safe position. All my weight's on that back leg. I got hardly anything to the front leg. What we do is we stick out our butt and kind of sit into the movement. So we'll sit back. Again, where's all my weight? The sound leg, I got nothing on the prosthetic side. Well, what we'll do is that we'll float that leg out. So we kick so hard to the front, never push to the back, and just drop the leg down to the ground. And again, where do I end up? In kind of the safe position. All my weight's to the back leg, hardly anything on the front.
So again, you know, when we talked last time about visualizing what's happening inside that socket, right? Before, when he was doing the leg.
Couple things. One is that when that person comes through, they float the leg. So they come in through, they push, all the pushing is to the front. They don't really push it all to the back. So they float that leg and drop it down. What you can do as a spotter, real simple. If you draw a line, take your hand. If you draw a line straight across from the other knee, come right across to the front of the prosthesis. I come through, I hit the spotter's hand. You're going to push backwards, teaching that person when you stop pushing to the front, when you start pushing to the back. What's the cadence inside the socket that we're looking for? Another thing when we do this exercise is shifting your weight. So always we ask the person when they come through, Mr. Jones, shift your weight. Person always like, I'm shifting all my weight. But then you can do this as a little test, as you come on through, and then you just be able to lift their leg up off the ground, right? And the person is always amazed when they see that, when they see you do that, because they're shifting all their weight. That's what they think, but really they're not. They're not shifting hardly any weight. If I was shifting my weight forward the way I should, you should not be able to pick up my leg off the ground. You should not be able to bend my knee. Okay? I'm forward shifting my weight. You should not be able to pick my leg up off the ground. You should not be able to bend my knee. I'm coming forward. Move on to what's called grid work. And grid work, what we'll do is we'll take as big pieces of tape, like a 4x4 inch square, like the size of a napkin. Put about 10 of them on the ground inside parallel bars. Number them 1 to 10, big numbers. What you're going to do as a spotter is you're going to call out the numbers in and out of order as you go through the grid, doing that same heel strike exercise, trying to hit each mark that's been called out. The repetition comes in is that if you miss one mark, you got to do the whole thing all over again. So this exercise, this can take 30 seconds, or this can take over 3 minutes. Okay, you come on through, just hit each of those marks that are called out.
The amazing disappearing marks. If you only remember one exercise for you guys, this is the one you should be doing every single day. And you know why? There's so much going on in this exercise. It's a strength training tool. He's working every aspect of his muscle inside that socket. He's pushing and pulling inside that socket in a rhythm, right? Very quick rhythm like this to get that leg to hit those marks, right? So it's a great strength training tool. What else is it really good for? Making sure you're doing what? Shifting your weight to the prosthetic side.
Thank you, Next Step Orthopedics. Woo!